Okay, so there's this drug you've probably been hearing about a lot. It's being called a revolution, a game changer, and today we're going to pull back the curtain and find out why it's so much more powerful than almost anyone imagined. Right now, when you think about drugs like semaglutide, you're probably thinking about one thing: weight loss. I mean, it's the shot that's basically reshaping Hollywood, and for a pretty good reason. The results, they really speak for themselves. We're talking about clinical trials showing an average body weight reduction of around 15%. That's a huge number, and it's exactly what put this drug on the map. But here's a wild thought. What if the most famous thing this drug does is actually just a side effect? What if its real job is something much, much bigger? So, our story really kicks off with a puzzle, a mystery that scientists weren't even trying to solve. They were just looking at the heart, and what they found completely stunned the medical community. So let's talk about something called the SELECT trial. The setup is super important here. They took a huge group of people who already had heart disease and were also overweight or obese. And you really have to pay attention to this part, these people did not have diabetes. And when I say huge, I really mean it. Over 17,000 people. This wasn't some small-scale test. This was a massive landmark study. Half the group got semaglutide, the other half got a placebo. Simple as that. So what happened? An absolutely incredible 20% reduction in the risk of having a heart attack, a stroke, or dying from a heart-related event. A massive life-saving benefit for people without diabetes. But this is where the real mystery actually starts. Now check out this quote from the New England Journal of Medicine. The scientists noticed that this heart protection, it started happening really early in the trial. Way too fast to be just from losing weight. I mean, weight loss takes time, right? This effect was almost instant. So this begs the question, what's the secret? What was this drug doing to protect the heart that had nothing to do with a number on the bathroom scale? But before we get to that answer, the plot thickens. Because as scientists kept looking, they found this mysterious guardian effect. It wasn't just for the heart. It was showing up somewhere else, just as important. And that brings us to the FLOW trial. This time, they focused on another super high-risk group of patients, people who had both type 2 diabetes and chronic kidney disease. These are folks at major risk of their kidneys failing. And wouldn't you know it, the results were, once again, just unbelievable. A 24% lower risk of a major kidney event. The drug was acting like a bodyguard for the kidneys, one of our body's most critical filters. And the good news just kept piling up. In that same high-risk group, there was also an 18% lower risk of heart attacks and strokes. And get this, a 20% lower risk of dying from any cause during the study. This was clearly more than a weight loss drug. This was a survival drug. So how? How is all of this happening? Well, the researchers themselves dropped a big clue. They figured its power might be coming from its ability to lower system-wide inflammation, stress, and scarring. It wasn't just fixing one organ, it was calming down a fire inside the whole body. But that still doesn't tell us how. To find the source of these superpowers, we have to travel away from the heart and the kidneys and go straight to the command center of the entire body, the brain. This whole thing boils down to a hormone called GLP-1. Your body actually makes this stuff naturally. When you eat food, your gut releases GLP-1 and it sends a really simple but really important message to your brain. It basically says, hey, mission accomplished, we've got fuel, you can put the fork down now. So what are these drugs? They're basically a supercharged, long-lasting version of that natural hormone. And here's the secret sauce. The little antennas, the receptors that listen for that I'm full signal, they're not just about hunger. They're located right in the middle of your brain's reward system, the very circuit that drives all our cravings. So here's how it all works. Think of any craving, whether it's for junk food, a drink, a cigarette. It's basically a dopamine signal screaming in your brain. What these GLP-1 drugs do is they just walk over to that reward circuit and turn down the volume. The signal is still kind of there, but it's not a screaming emergency anymore. The intense urge just fizzles out. You want proof? We've got it. Just look at this data from a huge study. People taking GLP-1 drugs had an 18% reduced risk of developing alcohol use disorder, a 20% reduction for nicotine, and an amazing 25% reduction for opioid use disorder. It's calming that reward circuit for everything. Okay, so let's connect the dots now. We've got the heart, the kidneys, the cravings. How does this one thing in the brain explain all of it?
Well, the answer seems to be that this drug isn't really treating a bunch of separate problems. It's targeting a central driver of so many modern diseases, a reward system and an immune system that have gone into complete overdrive.
So you see, by calming down the brain's reward system, it reduces the drive for the very things that cause inflammation in our bodies. That overall drop in inflammation then protects the heart, and it protects the kidneys. And the weight loss? That's just one of many good things that happen when you get the body's main systems back in balance. And all of this leads to one final, really powerful question. We went looking for a better weight loss drug. But what if, totally by accident, we found a drug that treats the root cause, the inflammation and cravings behind so many of our worst chronic diseases? The story of this medicine, I think, is really just beginning.